Hello, everyone. I hope you're staying well and healthy. I'm Soumitra Jha, an associate professor at the Stanford Graduate School of Business, and I will be moderating the special event hosted by the Stanford King Center on Global Development. This discussion is being recorded, and the recording of this panel will be available on the King Center's website early next week. Now, the Stanford King Center is dedicated to stimulating research to alleviate global poverty and inform policy and critical development issues. This requires a multidisciplinary and multifaceted approach, and the center supports large-scale faculty initiatives and emerging scholars from all of Stanford's 7 schools, and facilitates student opportunities for students from Stanford and abroad. The King Center also convenes stakeholders and policymakers from around the world and thought leaders in the public and private sectors. A lot of the audience has already been living through the COVID crisis in India. But before we begin the panel, I'd like to kind of set the scene by providing some salient facts. So if we go to the next slide, I'll show you a little bit of the time series as well as the cross-section of this event. So this graph shows basically in yellow, the number of COVID cases in India. As you can see, the number of COVID cases has been increasing almost exponentially since the beginning of the crisis. India has unfortunately moved up to number 4 in the world rankings. Of course, the United States remains number 1. But things have, this has happened despite 5 different types of lockdown which have occurred during this period. The lockdown began early, as you can see, in around March 24th, which was a very dramatic lockdown. The red line shows you the availability of food in the major markets, food markets of India. And you can see a dramatic collapse in the availability of food in the immediate aftermath of that first lockdown period, particularly compared to the other lines which show what the pattern was like in previous years. By April 14th, the government decided to open up to agricultural and transport infrastructure. And you can see there's a fairly dramatic recovery in the availability of food in the major markets. Things have since been opening up in steady phases. Different zones have been established, which have more or less stringent quarantine requirements in place for people moving between them. Most recently, we're in phase 5, where the government is focusing on economic opening up in a variety of different ways. In the next slide, we're going to show something about the patterns across the country. Now, India, of course, is a large and very diverse country. If you see the patterns of COVID relative to the population centers, first thing that jumps out to you is, of course, that places with more people have tended to have more COVID cases. However, there are some differences. As for those of you who know India, the area of Karnataka in particular, Bangalore, despite being a large city, has actually been able to maintain a fairly low rate of COVID prevalence so far. Other places, for example, in Bihar and Uttar Pradesh, in the north of the country, which are very densely populated and have large cities, have also had mixed kind of results in terms of the prevalence of COVID. With that in mind, the regional diversity in mind, I'd actually like to turn to our panel. So each speaker will have 5 minutes to share some opening remarks. Then I'll start to ask our panelists questions, and we'll have some discussion. So thanks everyone who already shared questions when you registered, and please use the question and answer feature to ask questions in real time. We'll start off with Professor Steve Luby, who's an infectious disease specialist and a professor at Stanford School of Medicine. Over to you, Steve.
I want to talk a little bit about the COVID-19 infection and the epidemic as it has swept across India. If we look at high-income countries, they used lockdowns early, and the strategy here was to flatten the curve to prevent overwhelming the healthcare system. But in India, with only 2.3 ICU beds, intensive care beds per 100,000 population, it really was not a sound strategy, because there's no way you could drive the number of infections down low enough so the healthcare system would not be overwhelmed. There are really few facilities in India that have the institutional arrangements to prevent healthcare facility transmission. The physical environment is not set up in these hospitals to do it. They don't have the supplies or the norms and practices or even the incentives to practice rigorous infection control. And so what the lockdown did was it drove people outside of the cities back to their homes, accelerating really the national transmission and not really resulting in a situation where the healthcare system will not be overwhelmed. Similarly, other strategies that have been used in higher income countries are not so readily adaptable to the Indian environment. For example, physical distancing is not feasible in a slum environment. According to UN Habitat, 24% of the urban population of India, or 78 million people, live in slums, which have population densities which just preclude physical distancing. Water's not readily available, so people have to wait in line for a long time for water. And again, they're right next to their neighbors, so there's no physical distancing. Recommendations of not going to the market so often so markets don't become crowded is undermined because people don't have the money to do that or the refrigeration. So in slums, there will be a lot of transmission. And of course, the slum population is directly connected with the broader urban population. In addition to the immediate problems of the virus and the fact that people will die from this, there's also profound consequences because of the lockdown and because of the loss of income. About 140 million workers lost their jobs in March, estimate a 25% unemployment rate. So this is all happening amidst 92% of the population being employed by the informal economy in a context where 38% of all of those children living in India are already so malnourished that they are stunted. So it's a precarious population that has now lost income, and so this has profound health consequences. In addition, because of COVID-19, there have been interruption of key health services, including immunizations and tuberculosis treatment. That further affects the population. So what do I see happening over the course of the next coming weeks and months? First, I think all of us communicable disease epidemiologists have been humbled with our projections. We don't know a lot about this virus. We don't know how long protective immunity, how well it develops, how long it will last. We don't understand the infection fatality ratio. So lots of uncertainty. And really even the reports that Sam showed on the number of reported cases are not great measures because the vast majority of people are not tested. So it's really difficult to comprehend the current situation. We know the numbers in the newspapers are not definitive. Nevertheless, the very diversity that Sam mentioned means that India will experience the outbreak differently. Large cities with crowded slums will see the fastest rise in cases, and there'll be different policies in different places, and so different rates of transmission. And also, different parts of India have different health resources, and so there might be some places that can manage this surge, while overwhelmingly, I don't think the nation will be able to do it. The healthcare system will be able to do it. The first wave will run through the population over months, not weeks, because of the high population density in the multi-generational households. The diversity across India, combined with the interconnectedness of the communities, will lead to ongoing transmission for months and perhaps for years. Although people are waiting for a vaccine is unlikely to be available in the intermediate term. 10 to 15 years is the industry norm for developing a vaccine. We've never developed a vaccine during an epidemic soon enough to stem the epidemic. I would consider estimates of vaccine availability by 2022 to be possible, but these would be unprecedented. I don't view it as likely, I view it as possible. Big question for India, like the rest of the world, is what proportion of people who become infected will die? What is the infection fatality rate? Because India is a young population, and we know that age is the single biggest risk for death, this would reduce the overall burden of death from COVID-19 in India. On the other hand, the healthcare system is likely to be overwhelmed, and so is unlikely to be able to service those people and provide life-sustaining treatment. And so that is likely to undermine the benefit of the younger population. So, for example, Imperial College London thinks it's about a wash and expect the overall infection fatality in India to be similar to what's seen in other countries. I would project that there will be lots of deaths, but that these will be poorly accounted for. If infection is protective, which I view as likely, India may be less susceptible to subsequent waves or a very long outbreak. If you will, there may be an advantage in not flattening the curve in that it will reduce the number of people who are susceptible. But we really don't know a lot about this virus, and so it's tough to predict. And so I think all of us in public health, and certainly the government authorities in India, will just have to hold on and make the best decisions they can. Back to you, Sam.
So next we're going to hear from Naushad Forbes, who's the co-chairman of Forbes Marshall, which is India's leading steam engineering control instrumentation firm and a former president of the Confederation of Indian Industry.
Thanks, Som. And thank you, Steve. That was very sobering. I'm going to focus on the economy and the impact of the lockdown on the economy. As Steve mentioned, we had a very stringent lockdown very early on. Oxford University ranked, I think, all the lockdowns that were underway in early April, and India came in at 100%. We came in at the most stringent lockdown that had been put in place anywhere in the world. The problem with the lockdown from a health perspective is that not only was it very stringent, but it was also somewhat porous. And because it was porous, for all the reasons that Steve mentioned, you saw a less than effective health outcome from the lockdown. But the economic outcome was very dramatic. In April, the first full month of the lockdown, the rough back of the envelope calculations that have been done and more accurate estimates coming out of the goods and services tax revenue that's been collected say that GDP fell by around 40%. May saw an easing of the lockdown, so some lower fall in GDP, maybe around 25%. But the Q1, India starts its financial year in April, so the first quarter of our financial year is what we're in now. Q1 will probably come in at around -20, -25% of GDP. And the overall impact for this year is estimated to be anywhere between -5 and -10%. And most of the revisions that have taken place over these last weeks have been downwards as the lockdown has extended beyond the first weeks that was intended. So a really devastating impact on the economy, concentrated in industry, but also in services, less in agriculture. The government has put through an economic package. This package has covered a fairly wide range of things. It's included some income support for a few vulnerable groups, but that's been spotty with quite a few gaps. It's included measures from the Reserve Bank of India to enhance liquidity in the economy, which have been quite effective. Some effective measures for small enterprises in the economy in the form of loan guarantees, which have again starting to be effective but came in quite late. And then some useful medium-term reforms for agricultural markets that will be very useful in the longer run, but will have no short-term impact. What there hasn't been is any widespread enterprise support or economic stimulus, and that shows in all the projections for the growth rate this year. If you look at what's likely to happen next year, we can look for a bounce back in the economy. But that depends on two things. It depends on migrant labor returning to the cities. As economists will tell you, one of the key drivers of economic growth is the migration of people from a lower productivity occupation to a high productivity occupation. So when migrants have moved from villages where they've been informally and employed at fairly low productivity levels, when they move to cities, you get a jump in the economic growth rate. When they move back to rural areas, you will see the opposite effect. And I think unless we see that reverse migration take place substantively, we will not see a substantial bounce back next year. And second, obviously, a bounce back in consumer confidence. I'm more confident of that happening, but that will also depend to some extent on rural incomes, which we're starting to see already. If you look at what's happened in each month, in April, we saw huge rises in the unemployment rate, which Steve referred to as well, rising from around 7% unemployment in March to 27% in April. But that's come back down, came to 21% in May, back down into single digits now. And with lots of recovery in consumer demand from rural areas. In the longer run, the fundamentals for the country remain strong and robust. But there are two dangers. And the two dangers are, first, as a result of the Disaster Management Act, Indian bureaucrats have rediscovered the joys of controls. And I think only if those controls are substantively given up again, will we get back to the kind of growth rates that we've got used to over the last 30 years. Second, the government's economic recovery package is called the Self-Reliance India package. And this self-reliance package has been accompanied by a degree of rhetoric that has been somewhat inward-looking and somewhat protectionist. The government claims very strongly that it is not intended as such. It's meant to be an outward-looking package, but the rhetoric around it is still largely protectionist. And I worry that those two elements, the resurgence of controls and this resurgence of protectionist rhetoric, could be very damaging in the long run. I'll stop there. Thank you.
Thank you very much, Naushad. We now turn to Yamini Iyer, who is the CEO and president of the Center for Policy Research in New Delhi.
Thank you. Thank you very much, Soumitra and Stanford, for having me. And thank you, Stephen and Naushad, for your very provocative comments. And you basically covered all the ground, which makes my work even more easy, because all that has been said has been said. But let me try and sort of bridge what has been said. And also what I thought I'd do in my opening remarks is to look at what lies ahead for the next 6 months. And I'll start with talking a little bit about the economy, building up from what Naushad was saying, and then look at some of the two important elements around managing COVID as it unfolds in the next few months and years, as Stephen reminded us. Sorry, something is not quite moving here. Just give me a moment. Yeah. All right. So as Naushad said, we have seen a significant drop in the unemployment rate now in June, ever since the economy has sort of slowly tried to come back and find its feet. But the important thing here is that there has been a sharp difference in the recovery rate between rural and urban, with rural employment recovery far better than urban. And one of the important things to note here here is that there are two factors that are enabling this improvement in rural areas. One is a relatively good agriculture season, and in fact, the sowing season has gone that we're currently in is going far better than it had even last year, according to some of the early data. But more importantly, also because of the big push that has been made in the last month in the National Rural Employment Guarantee Act, which is really the core employment program of the government that is providing a safety net at this time in rural India. And the question going forward, of course, is whether we have allocated enough and what are we planning to do for the next 6 months, because this is really now emerging as the critical sort of lifeline for rural India and for keeping consumption demand recovery in rural India going forward. And one of the reasons why I think we need to be a little more worried about this is because the lockdown, as speakers before me pointed out, had a significant impact on the economy. We switched the button off on an economy that is largely rural and where most are dependent on our casual workers and daily wage workers with very little and, in fact, for the most part, no social security. So once the lockdown hit, we saw a significant impact on income. There are now a bunch of surveys, I refer to a few in this presentation, that point out that most vulnerable populations were eating significantly less during the lockdown than they did pre-lockdown, and a serious indicator of increased vulnerability, that the income loss and employment loss was most high amongst the lowest levels in the income decile. And importantly, that even the relief that was offered in the economic package was nowhere near enough. And we have experienced a significant number of bottlenecks in the actual delivery of this relief. So as we look forward, we need to be thinking a lot harder about how to keep the momentum that we've gained in this last one month going. Naushad talked about the need for stimulus from the point of view of industry and small and medium enterprises. But I also wanted to bring the importance of private demand, bringing cash into people's hands. The NREGA is doing something important right now, but the current allocations are only going to meet the demand for work if it stays at the current levels for the next 2 months or so. And I think we are looking, as Steve pointed out, at a much longer challenge. The other important thing, and I'm going to come back to this in my remarks about the disease itself and disease management, but I think you saw in what Soumitra also pointed out, that India is experiencing this disease in its diversity. It's localized. We are experiencing it in different forms in different parts of the country, and it will unfold over time in a localized fashion, which means that we need to have a much greater agility in our fiscal transfer system to be able to ensure that financial resources are reaching those places which are most adversely affected at the time that they are affected. And lastly, to the point that Naushad made as well about migrant labor coming back into cities, I think one of the big critical reminders of this lockdown and the most defining moment of this lockdown that has been those harrowing images of a vast majority of India's workers having to walk home literally hungry and tired is the fact that we do not have a robust portable social security system that provides for people who move away from their rural homes and from their home states in search of work to other parts of the country. And that, in fact, is one of the reasons why, even though we have labor surplus and we do have a significant interstate movement, it's nowhere near what it should be at levels of GDP growth that India has, because our social security system is linked to states, but our labor market is now increasingly national. So we've already started talking about one nation, one ration card, which is portability for food. That's a complex process. I am not quite convinced yet that we are giving it the energy it needs to really build portable food and portable cash security in order to ensure that we are incentivizing and protecting the right to work and the dignity to work for most Indians as we go forward. So I think these are the three things that we really need to be focusing on as part of how we are thinking about economic recovery, even while we fight the disease. Let me now very quickly come to the big challenges I think we are confronting with COVID management itself. And here I'm going to draw on some data that my colleagues at the Center for Policy Research and I have been engaging with. We've partnered with the state government trying to think through testing strategy. And this is some very, very early data that we are beginning to analyze based on testing that was done in the state over April and May. And it's really giving us some important insights into what needs to be done going forward. The one critical thing that we've seen, and I don't have time to explain this graph, but it looks pretty, so it's there. But you'll see that the disease itself is spreading in a very clustered, localized way. Every district in our analysis we found has a very, very distinct pattern of the spread, and we actually try to map this to polling booths to find that in fact there is even a district is too widespread. The nature of the outbreak can be traced to polling booths, which are about 1,000 population. We found in our analysis of Punjab, which is the state I'm talking about, less than 2% of the total polling booths, of 80% of the cases could be found in 2% of the polling booths. This means that we need to have a very localized response, decision-making response to disease management, not just states, as we've been talking a lot about in the discourse in India, but down to the districts, to the municipalities, and to the panchayats. So much more focus on what are the kinds of decision-making tools that need to be given and empowered at the local level to be effectively responsive, and also how can we make our health infrastructure more agile to be able to move along with the disease. The second big question that we are confronting as we've been thinking about the question of testing strategies now that we've gone into the unlockdown phase, and we are probably, if not already, headed into community transmission, how do we get ahead of the disease to break transmission chains? And here the big challenge, I think, for India and across the globe is the widespread presence of asymptomatic patients. Our current testing protocols is largely limited to symptomatic patients and contact tracing of symptomatic patients. But in our analysis of contact tracing data in this state, we found that 55% of all the infections can be traced back to asymptomatic infections. So this is opening up some important questions. Is the current screening strategy that we have effective in this context? A recent Sero survey by the ICMR, which is out in the public domain, also seems to indicate widespread presence of asymptomatic, and that symptomatic testing is simply not enough to be able to identify a possible spread of disease. And this therefore then leads to the next question of what would be better risk characteristics that we need to identify in order to be able to ensure that testing is better at capturing the spread of the disease and therefore allow us to break the transmission chain. Just very quickly to show you this graph, as you can see, the red line, as the possibility of having symptoms increases, at least in this particular sample of testing, we in fact found more negatives than positives. So the need to look at asymptomatic testing, asymptomatics, or testing a new or thinking of random sampling of testing, so that we have a better sense of the nature of spread and so that we are in a position to get ahead of the disease is very important. And therefore, I think the most critical thing that we need to be doing going forward is being more open to putting data out in the public domain in all its granularity. So patient characteristics is very crucial. And for state governments to have the flexibility to start moving into more experimental testing so that we can deepen our understandings and get better at testing in a way that gets us ahead of the disease rather than chasing the disease as we go. I'll stop there and can come back to more details in the next round.
I'd like to kind of turn to a series of questions. Some of these are inspired by some questions from the audience. So Preet and a few others have raised the question. I think a common theme of the discussion, despite the grave challenges, there have been some effective responses. For example, the slum settlement of Dharavi in Mumbai, which many thought was a ticking time bomb, given its density, its shared toilets, and vibrant economic integration with the rest of the city, has been able so far to escape the worst of it. fingers crossed, in part due to the deployment of more than 2,000 health workers, testing and strong quarantines, and strong community support to deliver necessary supplies to those in quarantine. Do each of you have an example which you could point to of an effective response in India in the spheres of health, public policy, or on the business side, which you think is worthy of highlighting? And what are the generalizable lessons that we could potentially learn from those examples? Do you want to start with Steve again and go in the same order?
Sure. I think that India has a strong ASHA program. So they actually do have a very strong immunization program. And all of that means that you have strong connections with communities. And so the ability to leverage those connections for COVID, and I'm not saying this is easy, but you're building on a system and relationship. So if you think about, well, first you have to keep those ASHA workers safe. And think about appropriate PPE and testing, but they are a real asset that India has, and I think that we've seen this in the slum in Mumbai, and I think that there are other places as well that India can leverage this strength in terms of responding to this crisis.
So, should I go next, Sean? So I guess so I can give you three examples. The state of Kerala is probably the states that's handled things the best. They have a decent public health system. They acted very effectively early on. It's no coincidence that their health minister is a woman, and they have really played a very, if you look at the numbers for the state, when the lockdown was imposed on the 23rd of March, Kerala and Maharashtra had the same number of cases. If you look today, Kerala has, what would the number be? Kerala has around less than 5% of the cases that Maharashtra has. The state of Karnataka, where Bangalore is, has also handled things very effectively. The city of Bangalore, with a population of 10 million plus, has 1,600 cases, something like that. And like the city where I am in Pune, with a population of 7 million, has around 14,000 cases, just to give you a comparison. And then Dharavi, the example that Som mentioned, population of 1 million people living in a 2-kilometer square area, where they went house to house in the slum to 75,000 homes. So covering probably around half the population of the slum, measuring temperature, testing people, picking groups of people up, moving them to school so that they could be isolated. And Dharavi today has a case rise that is in the single digits. So it's been an extremely effective response. So you have, and I think that's where the future of India lies, and that's where the future of our dealing with COVID lies. It lies in individual experiences at the state level, and even more experiences at the city level. And the more we can, I think, share good examples city by city, I think the better off we will be.
Just to add to that, I think, the one common thread in all the examples that Naushad just gave is the very, very robust presence of local governments. The BMC, Kerala is the cheerleader in the country for rural local governments and urban local governments. And even Karnataka, actually, it was one of the early pioneers and in fact has been using its local government infrastructure very, very effectively ever since the pandemic hit. And the other common thread has been a very deep social solidarity, Kerala more than anywhere else actually, and a trust in the community, in community workers, workers, and in the government system. And I think those are the key characteristics that many parts of India don't have, and especially northern India doesn't have. And but I think there's a lot to learn from there. I have been a lone cheerleader for local governments in India for a long time now, and even state governments cry hard for more decentralization, but they refuse to do anything for local governments, given that it's under their mandate constitutionally too. So there are very important lessons here in what the future of a robust public health system should look like. And I emphasize the word public because that, I think, is something very important for us to learn from Kerala in particular. We need to carefully pass through what has worked, because that should feed into our future strategies going forward.
Thank you, everyone. It's good to hear about the kind of the positive things in this very dark time as well. I think, given the importance of local and state governments, it's been sort of an interesting pattern that, what started off as a very strong centralized response at the beginning of the crisis changed to a much more decentralized response as it evolved. But given that the virus is so contagious and India remains economically integrated, the decisions of each local and state government affects the others. And the central government will have to reassume a major leadership role if you're going forward. If you found yourself in an elevator with Prime Minister Modi right now, what advice would you give him about the role of the central government? And what about if you found yourself in a similar position with the chief minister of a major state like Tamil Nadu, currently going through a severe crisis?
Well, I guess I'll start. That's an easy question, of course. I think on the national level, I would really encourage government leaders to leverage the National Institutes of Epidemiology. The National Institutes of Epidemiology are great public health focused practitioners who actually can get an understanding of total patterns and pictures. And so I think instead of just going to ICMR, who think more like clinical physicians, I would really invest nationally at good data from public health experts. And that really sits in the National Institutes of Epidemiology. At the state level, I would urge them to think about oxygen and how you can get oxygen to your healthcare facilities. There's no way you're going to be able to build ICU beds and ventilators fast enough, but oxygen can save lives. So if you can get oxygen in and you can train your healthcare workers so they don't get infected, so they can deploy some of the things that we're already knowing works, like dexamethasone and remdesivir, you actually can save lives. So I would be focusing on those areas at the state level. Over.
So I think, I would actually argue for a smaller role for the center in the response that we're seeing. I would argue for the center to play a role of spreading best practice. So when one state is doing a good job or one city is doing a good job, to really make sure that everyone knows about it so that other cities learn from the experience in that particular city. And then second, I would encourage the center to write checks to the city and the states such that they can actually cope with their own responses and have the resources for their own resources for their own response. The one area where the center has played a role and obviously would need to play a role is in licensing of drugs and so on. And frankly, I'm very optimistic about the availability of medical equipment and the availability of pharmaceuticals in India, including vaccines. India, as you know, is the world's largest producer of vaccines. We produce, I think, somewhere over 2/3 of the world's vaccines. The largest vaccine company in the world is actually in the city that I live in. And the response from pharmaceutical companies has been very significant. I mean, there are now 5 Indian companies that are currently producing remdesivir. There are 3 Indian companies that are producing, I can never pronounce it, but Steve, you can, Parivar, something like that. Yeah. And there are, and the one thing that the initial lockdown did was it enabled us to establish a supply chain for PPEs and N95 masks, none of which were produced in India as of the 15th of March. And today, India is the second largest producer in the world of N95 masks, of PPEs. And I believe now we've also started seeing quite a flow of ventilators coming out.
So endorsing what both the previous speakers have said, particularly the point that Steve made about bringing the epidemiologists, the infectious disease people, our history in dealing with Zika, Nipah, HIV/AIDS, back to the decision-making table. And especially don't forget that the IDSP has, our disease surveillance program has a very wide network in states, which ICMR does not. And that's very crucial given how localized and how central the state governments are to this whole process. So, and we don't talk about that enough. So I just wanted to reiterate that. So point number one. The second thing, because I will hold the lift and make the Prime Minister wait for one more second, is taking forward what Naushad said about a smaller role of for the center. We still have the National Disaster Management Act as the key legal framework within which we are dealing with this. This is no longer a short-term disaster. This is the way we are going to be, to live with this disease, to learn to live as our policymakers are saying. So we need to find a different legal framework that does not over-empower the Home Ministry to bureaucratize every single decision and undermine the authority of state governments. And I live in the city of Delhi, where a lot of this politicization is taking place, even as we are dealing with a very crucial phase in the pandemic. Definitely write checks to state governments, but do so in a way that doesn't tie the hands of state governments to do your bidding. Right now, the only people that will be best able to determine how to give money, how to ensure the public health infrastructure is robust and that social security is provided is states. And for states to do exactly what they're wanting from the center to their local governments, because they need them as allies in this fight.
Thank you. A number of the audience have been asking about how different sectors are going to be evolving over time, particularly education and health. With international flows of people being arrested, even while there are strong voices in many countries, including India, as you referred to, Naushad, advocating for trade barriers, there's also an emerging paradigm shift in the delivery of services, including health, education, but more generally via Zoom and similar platforms, as we can see right now. India has traditionally had very strong advantages in the services sector. How do you see education changing, health changing, and other types of service delivery going forward? Are there opportunities here for India, kind of in sort of global perspective, or do you see it sort of being more of a negative shock that we face in these particular sectors right now?
Are you asking Steve? Or
I think everyone can answer.
Yeah, let's Steve start. Yeah. Steve,
well, I would argue from a health perspective, although there is an opportunity to do some outreach via Zoom and other things like that, and we can make some improvements that way, and we can imagine improving messaging that way. Overall, the high technology tends to marginalize the poorest. And so the dependence on technology risks further marginalizing those already who bear the highest burden. So I do think that there is an opportunity with the scale of this and just all of the innate creativity and inventiveness within the broad, diverse Indian culture, that I imagine a lot of good ideas and work will come out of this. But I am concerned in the intermediate term about what it means among those who are in the bottom two deciles, especially.
So let me give you two examples. One is in education. We work with some NGOs, and we were part of. My sister-in-law was part of a recent discussion where the children who were being, they're now back in school, but back in school for village children, they were using their parents' phones And these are small, very small phones. And the teacher was talking on the phone, and there was this class going on. And the remarkable thing is that it was working. But I think Steve's point that this is where inequality really gets worsened as a result of not having access to technology. Other end of the scale, we have an experiment underway just now where there's this company in Bombay that's launched an eICU. And the whole idea is to target it at COVID ICUs, and where you can then remotely monitor in, let's say, a nodal hospital, 100 ICU beds that might be in rural areas, that might be in smaller hospitals in urban areas. And it's a way of, it's not going to be the best. It's not going to be the Stanford Hospital scare by any means, but it's going to be a lot better than what would be there otherwise. So there is the potential for technology in health and education to have long-lasting benefits. And this is really giving, what we're going through now is really giving all of this a fillip. Whether this will start showing up in more competitive operations that we can do outside of India, I don't know. Let's see how it develops.
So I'll focus my remarks just on the challenge of primary education. I think one must remember that schools have closed in India as they have across the globe, but in India in particular, in the context where 50% of children finishing 5 years of schooling can barely read a standard 2 text. So our basic learning levels are pretty low at the best of circumstances. And the one thing that we do know is, attendance in schools, a particular kind of focused teaching at the level of the child does have an impact on improving learning outcomes relatively quickly. But being absent from school can have a significant drawback, can keep you in a significant stuck. My colleague Jishnu Das, who's just recently been looking at, put out a paper that looked at the impact of the earthquake in Pakistan on primary school children, found that the learning loss that they experienced in 8 weeks of being out of school didn't actually get was never made up over time, and in fact it accumulated and doubled. And I think that is what we really need to worry about, because we are closing schools in a low learning environment. But there's also an opportunity. There has been enough experimentation in India and a widespread recognition that foundational learning skills are the key challenge that we face. There is experimentation on how to reorganize classrooms so that you can teach at levels of children's learning rather than grade level, curriculum level expectations. Our policymakers are talking about reframing curriculum. So this is the time to think about how to reorganize the age, grade, curriculum, metric, and examination structure that has really been the bane of our learning in Indian schools, and think more creatively. And I think there actually is an opportunity that circumstances have forced upon us. And if we don't grab this opportunity, the learning losses we've already experienced. I have 2 small children and they have online classes, but I'm seeing the dip even amongst them. It's going to be a long challenge going forward. So it's an opportunity I hope we can grab.
Thank you. So a number of the audience have been interested in politics, and as you know, the political situation around the world is, shall we say, evolving. In the US, we have presidential elections in November, of course, and in India, there'll be a number of important state elections in the offing. At the same time, there's sort of been, to some extent, a degree to which ethnicity has played an important role in the way that COVID has been described and discussed in a number of different parts of the world. What do you see the impact of the COVID crisis is on politics in India and more generally?
I think I'm going to leave that to my Indian nationals to address.
So, in the short run, the Prime Minister's popularity has risen. I don't think that's deserved, actually, in terms of the handling of the entire situation. But it's risen. That's what the polls show. It's how things would turn out in the long run is what I think will determine longer term outcomes. I hope populations around the world will recognize foolish behavior on the part of politicians, whether it's in the developed world or whether it's in the developing world. And I hope that foolish behavior will be punished at the polls. I mean, whether it's in Brazil or it's in November.
So I think, we live in a world of complex politics where certain kinds of political decisions that at least significantly impact the economy and people's everyday lives, you would expect would lead to political consequences, and it's not always clear that it does. And I think that's sort of one of the challenges with trying to understand the sort of vulnerabilities that the lockdown exposed, coexisting with the increased, at least according to the polls, popularity of the current political dispensation. But I also think that it has a lot to do with how the opposition parties have responded to the current crises. And as long as you have that vacuum, there isn't going to be a political fill. I think the every fragility and inequality of the Indian economy and our society and the mistakes we have made, like all societies do, were laid bare in these 3 months. And yet, you don't see, at least for the moment, a active political mobilization that is creating a space even for a reasonable and rational debate on critical issues like labor rights. So I think that, really right now, the question is, how does the political opposition remobilize itself, which is a pre-COVID challenge, but I think gets sharper in the COVID context, to be able to occupy the space that it must and should. But, there is also when societies go through this kind of trauma across the globe, as we are seeing, new formations emerge because everybody is asking themselves, everything that you took for granted is now up for grabs. So I'm also hopeful that new kinds of mobilizations will emerge. I think the fact that vast majority of Indians did not listen to the demand made by the state, and by state, I don't mean a political party, I mean the Indian state said, stay put. And most of India said, I don't trust that you'll keep me safe. I just want to go home. I think there was a very strong voice of protest in there, and that will find expression in some way over time.
A number of the audience, including Jimmy, have kind of raised this issue about fake news, about medical information, and how this impacts mobilization as well as the response to the crisis. How can we kind of deal with the situation that there tends to be a lot of information and misinformation available? Are there kind of strategies that people can use to kind of discern better information? Are there good sources that you would recommend for concerned citizens who need to be informed and want to inform others about where to go when they're learning about the real facts?
This is a really hard problem with all outbreaks. Outbreaks that threaten people's lives are terrifying, and people are scared, and then there's a vacuum, and this gets filled often by misinformation. And this is not unique to India. It certainly happens in the US, but we see it in Brazil, very common during the Ebola outbreaks in sub-Saharan Africa. So this is a dynamic we know about. And there's all of this fake news. And I think even worse is that some of the populist politicians who are now in power have also not liked to hear bad news. And so they themselves have become sources of misinformation, including in my own country, in the US. So I do think this is a very difficult time for us as citizens to parse. And the usual recommendation I have in an outbreak setting is turn to your official government in terms of what they can tell you, but this has also been muzzled in country after country because of the decision by political leaders to muzzle and to alter this information. So I do think we are facing a troubling time, and I think it's particularly important to give credit to expertise, to look at the voices within society, your academic voices, your independent newspapers, the folks who day in and day out have striven to tell a straight story, and think about credibility of sources as you work to get information. And I can't, yes, the WHO is giving good information, but not down at the state level and at the city level, but individuals do know who are your trusted local spokespeople. And I think at this time, when quality of information can vary quite a bit by source, that it is important to vet your sources.
So I don't know if fake news and misinformation causes long-term damage. I mean, I think it causes short-run problems and grief, but eventually people figure out what the truth is in there, and it starts prevailing. So it comes through in the end, and I think people, more thoughtful people, as Steve said, figure out who their reliable sources are over a period of time, and then listen to them. I think the bigger issue, in a sense, is the point that you made as well, Steve, which is the fear factor. One of the things that we've done a very effective job of in India is of frightening people about the consequences of getting COVID. And as a result, well, two things. One is we frighten people about the consequences of getting COVID. And second, there are a lot of concerns about the state health facilities that you may end up in, maybe without a choice. And I think as a result, then people sort of put off actually discovering that they have the infection. So that's to me a much more damaging consequence of the fear factor. It's improving now as we have more flexibility in being able to go to private institutions, and as the public system also is developing in many places a good and more attractive reputation.
So on the fake news, don't follow any information that is given to you on your family WhatsApp group. That helps. At least that's what I've done with mine. No, but more seriously, I think in the long term, I think one of the challenges with that we're confronting is that we are still learning about the nature of COVID, and as a consequence, what you think you knew yesterday may well not necessarily be as certain day after tomorrow, and that creates a certain degree of uncertainty and lack of clarity. And I think the only way in which one can move forward is to be much more collaborative about how government is thinking about its data. So making it more transparent, bringing in the researchers, bringing in multidisciplinary work from the epidemiologists and public health to the economists, everyone else, so that we have a much better better understanding of what's out there, and we learn and we learn and we learn, and the more we learn, the higher the chances are that ultimately knowledge over fake news will trump. But I also wanted to just highlight that there is another related issue, and it's not so much about fake news as much as the fear factor that has also associated with it a deep stigma. And that's really something that we need to take very, very seriously, because that social stigma is making it very difficult for us to actually put more light and sunlight on the nature of the disease. So one of the big challenges, I think, that governments around the world, and particularly in India, as we ramp up testing and start thinking about surveillance testing and not just testing for therapeutic purposes, is going to be the question of how do you address stigma and build trust so that people are willing to come and get tested so we learn more about the disease. And there, the combination of fake news as well as the sort of, the big shock value of fear that was instilled into the community comes in. And the deep inequality, I think, adds to it. Just in our own everyday lives, the constant reminder of everybody we encounter, put on your mask, don't stand so close, etc., etc. It serves an important purpose, but it also creates a psychological impact. And I think we have to learn how to do this better. And that's where the point, Stephen, that you made about the ASHA workers and our community health system is so important, because ultimately they are the ones who would be best placed to really build community trust and deal with these challenges of stigma. These are not going to be easy, but we need to recognize them and confront them.
So we're reaching the end of our hour. The motto of the country is Satyamev Jayate, let the truth prevail. I'm so glad to have been joined with you to kind of this fantastic panel to do just that and penetrate some of the fog that we're facing in this crisis at this moment. So thanks a lot to our panelists, Steve, Naushad, and Yamini. Thanks a lot to the King Center. I hope you enjoy the rest of your morning, afternoon, or evening. Goodbye.